The CDC is strongly encouraging everyone to get vaccinated against the influenza virus as soon as possible. To find a hospital or clinic near you with the vaccination, call the number on the screen.
In an astounding ruling, the Supreme Court has declared that families may now refuse vaccinations on the grounds that mandated vaccinations violate their personal beliefs in addition to medical and religious exemptions. With vaccination rates at an all-time low, doctors are reporting concerns about significantly increased numbers of influenza cases in the coming winter months.
It was reported that less than 40% of school-age children in the Northeast have been vaccinated against the flu this year, despite the predictions of an especially harsh winter.
Vaccines prevent the individual who receives the vaccine from getting ill from one specific disease. If enough people also get immunized, it creates something called a herd immunity, in which so few people are susceptible to the disease that it effectively eliminates the possibility of an outbreak of this disease, even amongst those who do not get vaccinated. Because so few people were immunized for this virus, it was able to spread like crazy, as we predicted. Each time this virus reproduces in a host, it introduces the potential for mutation, which is exactly what has happened here. So now the virus is mutated into a form which the vaccine is not effective against. This means that even those who received the vaccine are now at risk. Had more people gotten the vaccine, this likely would not have happened, or could have at least been slowed to a manageable rate.
Patients have been flooding healthcare facilities complaining of symptoms of an unknown illness. Scientists have reported a virus classified as the JX53V is reported to be a mutation of the influenza virus. JX53V emerged as a result of the high volume of cases this season, which in turn was a response to the public's lack of flu vaccinations.
It was confirmed today that the JX53V virus is, in fact, transmitted through the air.
The CDC has quarantined 3 of New York City's 5 boroughs after a record 394 confirmed cases were recorded in the area.
Public transport has been shut down in highly populated areas, and people are being encouraged to reduce travel as much as possible.
The Marseille Province Airport was locked down this afternoon after a man, Harris Johnson, collapsed in the terminal. Authorities report that he was showing symptoms of the JX53V virus. Accordingly, Johnson had shown no prior indication of illness.
The CDC has declared the JX53V virus a national epidemic.
15 deaths from the JX53V virus were confirmed today by the CDC.
There are now 7 confirmed cases of the JX53V virus in the UK and another 3 in Spain. Many airports are locking down their planes and fewer flights than ever are able to leave the terminals.
The CDC has quarantined 3 of New York
Thousands
City's
are
5
traveling to
boroughs
Vatican
after a
City
record
this Easter season, despite the
394
quarantine that
confirmed
Rome has been
cases
under for the
were
last
reported in the
month.
area.
Government officials are struggling to control this huge influx of people, many of whom have likely contracted the JX53V virus.
A massive funeral outside of Baton Rouge, Louisiana was held this morning for the 247 victims of the JX53V virus.
In the last 10 days.
Officials report that the number of JX53V virus cases has exceeded 100 million across the globe. Experts believe that the actual amount of cases is higher due to likely unreported incidences. Government leaders have locked down all borders and restricted travel except in emergency circumstances. The interim director of the CDC has officially declared it a pandemic and is urging people to limit all travel within the country to prevent contraction of the disease.